Good morning and welcome back to Daybreak. It's 20 past 7, so thank you for staying with us. So that's something really cool. Stem cells are taken from your own body, processed, and then injected into places that are hurt or damaged, and research has helped medicine reach new heights. And they're here in Cayman right now to talk to us all about it. Hi, Jeremy, how are you doing?
How are you doing, Tony? I'm doing pretty good.
Yeah, so this is you're Jeremy Carreno from STEM MD, correct?
I'm from the Pensum Health Clinic.
Pensum Health Clinic, yeah.
Yep.
How are you doing?
I'm doing pretty good. Pretty excited.
Welcome to the set.
Yes.
First, we're just going to talk about what stem cells are and how they have healing powers.
Sure. So for many years, a major gap has existed for treatment options between conservative medicine and surgery. This gap is now being filled by regenerative medicine using stem cell injections along with platelet-rich plasma and powerful growth factors. What's so neat about these stem cells is that they are basically undifferentiated, which means that they're not programmed to a specific cell lineage. So when you put them in the body, they can actually replicate and mimic with wherever there's damage and become that cell type.
Okay.
Causing regeneration, healing for that specific region.
Which is amazing because you're taking it from your own body that's already damaged and then injecting to yourself to then, rejuvenate yourself. Absolutely,
absolutely. And that's one important factor. These are adult stem cells. So at our clinic, we basically draw blood. We extract a small amount of fatty tissue and aspirate some of the liquid from the bone marrow. These are all factors where you find an enriched source of stem cells, and it's minimally invasive. We don't do this under general anesthesia. It's all localized.
Okay. Wow, that's amazing that this is non-surgical as well.
Right. Exactly. So patients go home. They're in a little bit of discomfort, but a lot of patients are back out doing their normal activities, and in a few days there are no restrictions. Unlike surgery, where you have to stay bedridden or off, your specific body part, this is pretty much all not invasive.
Okay, so now that we know this is non-surgical, what type of procedures can you perform?
Sure. So what we typically do is we draw blood. Which is a very strong source of growth factors, platelet concentrated plasma, where we would spin down the platelets, and these platelets released as healing entities. We would also extract a little bit of fatty tissue, which is enriched in mesenchymal fat stem cells, and also aspirate some of the liquid from the bone marrow. Now, when I mention bone marrow, this sounds very ominous to most people because they figure, well, they're going to extract fragments from the bone, and it's not the case. We have a very specialized needle, okay, and this is done in a very minimally invasive route. Under localized anesthesia, we aspirate some of the liquid from the bone. It's almost like drawing blood from the bone. We spin this down, we concentrate it, we have special LED lights, special cytokines growth factors that we combine along with it and inject it right back into the area of concern, and there you have it.
Speaking of areas of concern, right. We were talking about facial rejuvenation as well, correct?
Correct. So what we normally do, we specialize in orthopedic musculoskeletal, but this science is so exciting that they're using it in cardiology, neurology, and again, one of the most biggest fields is, of course, in aesthetics. So they take PRP, concentrated growth factors, and fat transfer stem cells, and they basically inject it into the areas in the face to help give the patient a long-lasting, perhaps an indefinite results, rather than Botox or the traditional aesthetic medicine where it can only last up to a year.
Okay. That's amazing. I think this is a great field that's only going to be growing, right? We're only learning more about it every day.
Absolutely. I mean, I worked for Dr. Joseph Parita, and I consider him, he's an orthopedic surgeon, but also a very active scientist. And you have to be that. You can't rest in your laurels. If you do, you will stay behind and you will miss out on a lot.
That's amazing. Thank you so much for being on the couch with us this morning and talking to us about stem cells and all the research that's happening. We can find you at the Island Living Show, correct?
We are located in near the Cayman Clinic, and yes.
Yeah, and you'll be at the Island Living Show with all of us. I'll see you there.
Absolutely.
Thank you for staying with us. Experience the Ritz is after the break.